It's like little Elizabeth. Elizabeth was a small, petite young woman. And this guy, Tony, just assaulted her again and again and raped her over and over. They did nothing. And except one day, suddenly, they transferred her to the Hobson. Not long after she moved in there, she was found in her bathtub, strangled to death, having been raped.
And this approach, rooted in compassion and equity, as well as determination and data, will prove its effectiveness.
How much fentanyl is in this building?
Sealed and full of them everywhere.
We will continue in partnership with the new Regional Homeless Authority to get people off the streets, to get people into housing, and to give them the opportunity to reclaim their lives.
Any of them go to treatment or anything like that? Yeah. Is it hard to see?
One widely held belief is that behavioral health issues like untreated mental health or substance use disorders are root causes of the homelessness crisis that we see all around us. This is wrong.
Do you feel like first responders are called more to these buildings than, you say, your average apartment building?
Oh, I know they are. That's the whole basis of my approach, is I'm just looking at hotspots.
This approach works.
I've lived there 10 years now.
10 years.
And I've watched 30 people die.
So they're declining inside of these buildings?
Rapidly. They came right into an environment, we put them right into an environment where the drugs are being used. No one cleaned up there.
I'm going to show you a series of stories that paint the real picture of Housing First in Seattle. Housing First is a policy and strategy that is aligned with harm reduction. It provides access to barrier-free housing for our community's most vulnerable adults. Those who make it in are placed in buildings with little to no instruction on how to improve their lives, even though that is why they move into housing. You will see that it's hard to tell which is worse, living outside or behind closed doors. Community leaders like King County Executive Dow Constantine and the King County Regional Homeless Authority claim there is substantial evidence of Housing First being an effective solution to homelessness and a frugal approach to accessing support services. They also report a reduction in the use of public services like first responders, hospitals, jails, and emergency shelters. These claims are unfounded, but don't let me convince you. I want you to hear it from the experts. Thanks so much for coming and interviewing with me today. I usually ask people to introduce themselves and say where we're at.
I am Amy Smith. I'm acting chief of the Seattle Care Department, which is Seattle's third public safety department. I have oversight of Seattle 911, which gets about 900,000 calls for service every year. And then I've set up the first pilot mental health team to be dispatched right from 911 to behavioral health calls.
Well, I'm Tim, and I live in BSC. Housing.
I'm Michelle Huckabee-Virk.
Where do you live, Michelle?
I live in the Josephium. It is here in downtown Seattle.
Okay, my name's Craig. We're in the Inner Bay building for low-income housing.
We're in Seattle, Washington.
South Washington, yeah.
So you moved into this building when it was new?
Yeah, I was like the second group in there.
My name is Dennis Bateman. I live at Patrick Place Apartments.
What is Patrick's Place?
It's a permanent supportive housing, low barrier, harm reduction. It was a pilot program for CCS. You can come in there and do your drugs and your alcohol in your rooms.
And did they make that common knowledge when you moved in?
Yeah.
I'm Eric Burton, Deputy Chief of the Seattle Police Department. We're in Seattle, Washington right now. I've been on the department for 37 years, and so about 14 years in narcotics work.
What industry do you work in?
I work in supportive housing buildings for people who are formerly homeless, and I work with the most vulnerable people in our community.
How many buildings do you have access to in the city of Seattle? Or do you work in and out of?
At least a dozen or a couple dozen.
So you get the opportunity to see what's happening in a few different organizations.
Yes.
Bart, thanks for meeting with me again for another episode of Modern America. I know that you worked in social services for a period of time, and I'm covering some stuff on Housing First.
About 10 years or so, yeah.
Well, I'm Caitlin McKenney, formerly Caitlin X. I just got married. And we are in Seattle, Washington, downtown at the Office of Discovery Institute.
Are you specifically familiar with Housing First buildings, with permanent supportive housing buildings, with DESC, Lehigh, Plymouth, Catholic Community Services?
Yeah.
And are you aware at all? So I've went in, or at least interviewed people from a couple of specific buildings, and I had pulled some data just from police and fire. The police reports, of course, take a little bit longer to get than the fire. But with fire in particular, one of the buildings on Rainier Avenue South, there were over 286 calls in 2023 and 180 something in one of the other buildings in 2023. How much, I mean, there's this idea, right, with Housing First that these buildings are going to help people improve their quality of life and, essentially save taxpayers money and, get the problems off the streets. Do you feel like first responders are called more to these buildings than, you say, your average apartment building?
Oh, I know they are. That's the whole basis of my approach is I'm just looking at hotspots. So I'm analyzing 911 data all the time. On the criminal side, and again, I'm very embedded in both police and fire. We are acting as one public safety team. I'm in the police crisis data all the time. They have world-class research and analytics in that department, which complements and supplements what I have in 911. And I can see consistently that half of the top 10 hotspots, calls for service in 911, are going to these 5 locations. So then what do? I go spend time there and try to understand what's happening. It's important to say I just am not wired to assign blame to people. I don't think in those terms. I'm just a systems thinker. I know that the system's always designed to get the results it gets.
Which is why I'm so excited to talk to you, because we're just talking about the system.
Totally. And so when I go, I've talked about the Morrison Project. That's like my emphasis.
That's a big hotspot, I would imagine.
That's right. I dispatched police there 185 times last year. Again, John Ehrenfeld's team at Health One, they went out a lot. You can look at co-response and secondary response units. And I can see there my interest is, 25% of those calls are crisis calls. They're just purely crisis calls. Somebody thinks they have spiders coming through the wall or, all different things that are just human behavior things. And so, in partnership with other people, Barb Biondo's one, she's a crime prevention coordinator, leadership at DESC, that site manager, we're using this to go, okay, what could we change about this environment? If I know the calls escalate after 5 p.m., I presented this to council. Why might that be? Is it because case managers leave?
Right. Your daytime staff is no longer there after 5 p.m.
Yeah.
Right.
And so rather than continuing to triage and wait until somebody is in crisis, what can we do to improve this environment? So I've got 190 people with very high acuity diagnoses, lots of trauma past, all co-located. Many are hungry and bored. And so again, this gets pretty simple. That is going to be an environment where you would naturally have what's called collective disturbance, right? Where we're kind of pinging off one another. And if we're around a lot of anger and hostility, I'm likely to react to that, especially if I have a history where I'd be very sensitive to it. I think it's predictable. I don't know, just as a person, it doesn't make a lot of sense to me to co-locate like that with so much density. I just think it's always going to be very hard to manage.
How often do you see law enforcement, fire trucks, EMTs, SWAT teams? Daily? More than once a day?
More than once a day, yeah, mostly. But at least daily.
The entire time?
The entire time.
How often do you see law enforcement or first responders, fire department, EMTs here?
Every day.
Every single day?
Just about, yeah.
More than once a day?
Sometimes, yeah. Like the other night, they was here like 4 times in a row.
What about law enforcement and first responder engagement? Was that a regular occurrence? Mm-hmm. I know there are a lot of calls that go to this permanent supportive housing buildings, and
there's some of the higher use.
And how much is that affecting your priority 1 calls? Because you guys are responding to that. And I know some of those are priority 1 calls.
Yeah, some are. That's what I was just about to say is that, high utilizer facilities draw on our limited resources. They just do.
Yeah.
That's just reality. But we don't prioritize those calls differently because of that.
Right.
They're still prioritized based on the circumstances involved with the case. But it's certainly a draw. It's certainly a draw on limited police resources.
What about police and fire interactions in a lot of these buildings? Are there a lot of calls that come to the buildings?
I can't speak to specific buildings and how many, but I do see lots of first responder activity, whether it be police, fire, both at the same time, responding to many different events. And it's very difficult to watch that because every time that happens, it's traumatic for the community, it's traumatic for the person, it's traumatic for the staff. And so that just keeps happening over and over again.
While you worked in these buildings, how often did you see first responders, police, fire, EMTs?
Often.
Often? Daily sometimes? Yeah.
So you ended up living in the Estelle building, which is a downtown emergency service center, permanent supportive housing building, correct?
Right.
So let's talk about that a little bit.
Okay.
How did you end up there?
Through the coordinated entry program. See, I'm a veteran, like I said, and my housing coordinators were from the Washington State Department of Veterans Affairs and the King County Veterans Program. I had two of them.
And let me ask you one other question before that. Do you have a criminal history?
Oh, yeah.
Oh, you do? Okay.
Yeah.
Yeah, okay. I was just wondering because based on a lot of your history, it sounds like your coordinated entry score would be kind of low.
It was.
Yeah.
Yeah, it was.
But it shouldn't matter
11.
because you're a veteran.
It was an 11.
Oh, yeah, that's pretty low.
Yeah, so, I was, so I'd been homeless, okay, before they came to me and said, you might want to revisit doing that assessment, okay?
Did they coach you to sort
Jack
of
my
embellish
score?
your story?
They pretty much did it for me,
Okay.
okay, because I don't lie.
I say that because I was a service provider, and that is a thing that I did as a service provider to try to get my folks into housing.
Any high risk, okay, intravenous drug usage, whatever the high risk was, okay, being beat up all the time, yes, I became all of that. I was pretty much intimidated or manipulated into taking this apartment. I did not want it. I did not want to live under the thumb of DESC.
What was the process like when they told you that you had housing and then it was time for you to move in? What was that process like for you?
Well, I didn't want to come here,
Yeah.
okay? And they told me if I didn't come, all right, that they had to wash their hands of me. They would give me gas cards to any place I wanted to go. Of course, I didn't have a vehicle. SPD took that, The gas cards would be useless. So it was either, no option for housing and live on the streets, or take this apartment and have a roof over my head.
So, okay, so you've lived there since the building opened?
Mm-hmm.
Yeah, and so
I was the first resident.
When was that?
I moved in on February 26th of 2018.
Okay.
The grand opening with Mayor Durkin's news conference was on the morning of the 27th.
Okay.
I was the first one to spend a night in that place. I was the first one to sign a lease. I'm the longest standing resident.
What kind of freedom do you have to change buildings if you want to?
Oh, I'm not going to get a transfer. I've tried, over the years to get a transfer. Oh, yes, many times.
And
in
you've
different
been denied.
ways. Oh, yeah, always. Yep.
Do you see open drug use in the building?
Oh, yeah, most certainly.
How much fentanyl is in the building?
Basically, everybody there uses fentanyl, but a handful.
And what about meth and crack?
Meth and crack, those are the handful.
How many deaths have you seen over a 6-year period?
Over 60.
Inside of the building?
No, not so much inside of the building, but people have been transported to the hospital and perished there as well.
Perished in the from the building, residents.
Right, and then some have gone downtown and perished downtown.
How much fentanyl is in this building?
A lot.
A lot.
See them for them everywhere.
How many residents do you think have substance use issues?
I'd say like at least 83.
83%? What about the other 17%?
Rental problem.
Just straight mental health problems. How many deaths have you had this year? Do you know?
A lot.
Just in this building this year? Yeah.
Especially on fentanyl, yeah. A lot.
Do you ever see public drug use in the common areas? In the building?
Lately, yeah. Ever since fucking COVID and all this other bullshit, yeah.
What changed before COVID and now? Because I would imagine, there's been a change everywhere.
It's more like way out in the open. Like people in here, like they don't care.
They don't care anymore.
They just stairway, outside smoking area.
And what do the staff do about that?
Oh, damn thing.
Nothing?
Well, what can they do? They can't do shit.
Right. But what kind of stuff was happening in the apartments around you?
At first, when I first moved in there, and we were all like 75 of us just brought in there right from the streets.
Right from the streets.
Right straight, survival mode still, 100%.
No training on how to live inside, nothing.
Nothing about, we could still do our drugs. It was basically kind of like a crack, we were running a crack motel.
Like New Jack City?
Yeah, we were just doing it. Drugs were going in and out, people were sneaking in and out. There was no, there was no structure there. We just ran the place. I got to know a lot of people there, became my friends. Yeah, a lot of them died. It makes me sad to think of that. But
How many times did you find clients dead?
A few, but it seemed like a massive amount after I left. There were a lot of them that passed away there. A lot of them.
They overdosed on crack cocaine, which was really fentanyl. And there was about 8 of them who were affected. 6 had passed away. That was a game changer.
When did this happen?
This happened in the fall of 2022.
Okay. So pretty
a lot
recent.
Of things, yeah.
Have you seen a number of people die in the building over the last couple of years?
Yes.
Yeah. And it's been happening more rapidly?
Rapidly.
Of the people that live in the building, how many do you think are drug addicts? A lot? A lot.
What?
Yeah. Do you ever see any of them go to treatment or anything like that? Yeah. Is it hard to see?
Do they
But
help
they
people
travel.
get clean and sober?
I ain't never seen nobody get clean and sober.
How many people do you know in this building that have gotten clean and sober because they got into housing?
Oh, 5.
5 out of an 8-year period. And do they live here still?
No.
They don't live here anymore. Yeah.
So the people that I was engaged with, the clients that I was working with, would be placed in the place I live. And now I got my neighbors and people around me, people I'd taken machetes from or got between knife fights with or taking a gun away from people. You got an option. You give me the gun.
People were able to get guns into these places.
Oh, yeah. I caught a guy in the stairwell. I had seen him on the camera. I went, hey, dude, you got to give me that gun. Yeah. Either give me the gun or you got to leave. That's your 2 options. And dude's like, well, there's a third one. I could shoot you with it. I go, dude, really, that's not going to be good for you. I was like, oh, I need to use my skills now, So
Yeah.
there was a lot of that happening in there. The people that were there, people came in clean, and a month relapse.
Yeah.
And I was like, sad to see that because they came right into an environment. We put them right into an environment where the drugs are being used. No one cleaned up there.
Yeah.
At all when I was there.
That building in particular was an alcohol management program. We had 92 clients, I started to say this a minute ago, between that case manager friend of mine and myself to deal with. 8 floors in a tall building with 92 clients to try to keep up with all their needs. And that's a little much.
Do you think that the majority of people that you've worked alongside of or for are equipped or have the experience necessary
many of them have never been exposed to that at all.
Staff, they can't They can't handle, like, a lot of times people like us, it's like mental or like physical. They don't know what to do, that they can't handle people like.
Do you think that the staff are equipped, do you think?
Hell no.
Do you think that they're familiar with the population?
Hell no. Not
Yeah.
even close. Not even close.
How do you feel about 92 addicts and some with mental illness being shoved into a building?
It's like a ticking time bomb.
Is it?
Which it is.
What are some of the most intimidating calls that you're familiar with?
Probably the most scary ones are when someone appears under the influence of something that's thrown them into a deep psychosis or some kind of mental state where they're not reachable and they're almost out of control. It's extremely dangerous for the staff, and we're not trained to deal with that. And this doesn't just happen with people in the buildings, it happens around the buildings, on the streets, and it floods into the buildings. And so watching people that are suffering from extreme substance use, which may or may not be complicated by mental health concerns, that they are existing ones they already have, that's very dangerous. And it's very scary to watch that. And every time I'm a part of something like that, I walk away with scars, and I have to manage that, and there's no support for me on that.
How long do you see yourself staying in this line of work?
For me to be able to survive all that secondhand trauma, I honestly don't know. I've gotten to a point with a year and change there that it's exhausting to me, and it's almost, I'm starting to see myself not being able to be involved with it unless I'm involved with something that's solution-oriented, that's actually helping to influence people's lives positively, not just letting them flounder.
What about client on staff assaults?
Nothing was done. That pissed me.
Did that happen quite
Yeah,
a bit?
I
Did you
got hit
feel
in the
like
jaw.
staff weren't supported in their positions when something like that would happen?
I read about an incident that happened here last year. Are you familiar with it, where there was some sort of hostage situation?
Yeah. That's the dude that lived like down the hall, the end of the hallway. Yeah.
Yeah, who was taken hostage? Was it staff or was it residents?
From what I heard, 2 staff members. They came in here at least 30 deep, guns blazing out, SWAT, fucking snipers, the whole thing.
We have a recovering friend that works at the Inner Bay. She didn't tell me this, but I learned she and another person were held hostage in an individual's unit last year.
Oh yeah, this is not unusual. I'm not even surprised.
When somebody comes to visit, if somebody's coming to look at the building, what happens? Do they fix it up to look different? Do they make?
Oh yeah, if they know, and they get a heads up when Seattle Housing Authority's coming through.
Yeah.
Yeah. So this is what this guy's been doing. Okay, he's been sprucing up the outside. Okay, removing the graffiti and stuff off the pillars and the side, getting the glass, because you have psychotics in there that bust out the windows continually. Okay. Six stories up and glass raining down, it's onto a public sidewalk.
Do you feel like they just snatched a bunch of people off the streets and stuck them in here, and that they just were essentially cleaning the mess up off the street?
Yeah.
So people didn't have to look at it?
Yeah.
And that the streets are happening right here inside the building?
Yeah.
KCRHA, are you familiar?
King County Regional Housing Authority.
That is correct.
See, I just became familiar with that agency when I knew Charles Swag, who used to work at the Patrick Place, and he now works for that agency. I didn't really realize that they were so involved with what was going on as far as once I learned that they own the property, the King County owns the property. I don't really see them active in anything that I've worked at. They come out and visit the site once in a while.
Do you know ahead of time before they come to visit the site, and so the buildings are cleaned up and things like that?
Yeah, we know.
And then let me ask you this. So when they're touring rooms, are there rooms that are chosen intentionally?
Oh, yeah. I chose rooms that were kept upright.
Yeah.
I didn't show them the rooms that, or some of the pallet shelters.
Yeah, how many of the
discussed
rooms on
between us.
average are a nightmare?
Well,
Is it a significant amount?
Yes.
In a lot of the buildings?
Yes.
So, and when they come and visit the buildings, do you think it's kind of like a smoke screen that is created so that they're sort of set up to view?
Oh, yeah. It was like, show them the right room, Show them this room that's well kept. Don't show them their other rooms.
Yeah.
Don't let them see that.
Do you feel like people are just shoved into the buildings so they don't have to be seen on the streets?
Evidently, that seems to be what it is. We run the shelter programs and get people in there. We start, we meet them where they are, kind of thing. That's what the harm reduction is, meet them where they are. And, I'm kind of like...
Meet them where they are and then let them hang out in their pile of crap.
Yeah, I'm kind of like, I'll walk with you. I'm not going to, I'll walk with you in your journey. Let me walk with you. I'm not going to meet you where you are. I'm going to stay with you and help you through this journey. We bring them in, the public's satisfied. They don't see them on the streets. We're doing our job. No, you're not doing your job. You're not helping people rebuild their lives like your mission statement says you are.
What are the environments like on average?
I can't speak directly to the environments out of respect for the people that live there. But I will say it is a less than desirable and less than sanitary way of living, which not only affects their own personal health and happiness, but also the neighbors, like all the people around them, not just the neighbors in the building, but in the surrounding neighborhood. There's definitely issues there.
How many people that you know in the building over the 6 years that you've been there since the building opened have you seen want to try to improve their life and ask for support from the staff? Have you seen any of that?
I know a woman, okay, that lives there right now, and I knew her while I was housed, okay, in Renton.
Before you became homeless?
Yes, okay. And then when I became homeless, I saw her up on North Aurora, okay, where I stayed, okay, I stayed up there. And then she moved into this apartment building. She has been attempting to go to treatment for as long as she has lived in that building.
And how does a person go about attempting to go to treatment in the building?
Well, I happened to be visiting with her when the CD, the current chemical dependency lady, okay, licensed, okay, showed up at her door, okay, and they were talking about getting her a bed for treatment.
Yeah.
Yeah, that was 6 months ago.
She hasn't gone to treatment yet?
No, and she's disintegrating.
Yeah.
Very quickly. When she moved in here, she must have weighed all of 85 pounds. She was a walking skeleton. He did nothing to help her. I bought her aminos and proteins and all kinds of stuff and muscle milk. None of that did any good. Anything that she took down, it would immediately come back up. And she was out one day, out and weak, and she collapsed. And she went to the hospital, and they discovered she had corona. And while she was being treated for corona, okay, and also starvation, they discovered that when she had her stomach stapled at one point, it collapsed and it cut off her stomach. So the only food that she could get down would stop at the entry to her stomach, okay, and back up into her esophagus. But had they had medical here or anybody concerned, okay, they may have been able to intervene long before that. She just happened to get COVID and collapse.
Yeah, thankfully, right?
Yes, and a strong woman she is, okay, to survive all of that. Do you understand? But see, she's not going to survive much longer.
You don't think she's going to survive much longer?
No, she's drinking herself to death. She's an alcoholic, and she's drinking herself to death, and she's been trying to go to treatment.
And they're not helping her?
They're not helping her.
How many people have you seen in that condition in this building?
Oh, many, and we have another lady, okay, that I adore, okay, and she's body's swole up, I mean, huge. She's gone into the hospital a number of times. It's either her brain or her liver's going to give out,
And there's no intervention with the supportive staff in this permanent supportive building?
None.
Okay, so you're aware of Housing First?
Yeah.
And the idea behind that?
Yeah.
So that the idea is, well, what's your perception of it in your own words?
It sucks. They say that they'll have this and this and this. I say they'll help you, but they only help me to a certain point.
Yeah. And what were you looking for help with?
I don't know, just like structure, like slow down my drugs and shit like that. Try to leave myself alone.
So you were wanting to get clean and get your life together. So is there any kind of support in the building for that?
Fuck no.
First of the month, people get their money. They get their drugs. Everybody goes to their rooms. Things are fine. They're doing their drugs. About the 5th or 6th, 7th, they come out. Now they're arguing with each other. You stole from me. You owe me. You know, right around the 15th, it kind of calms down. There's not as many fights, not as many accusations. About the 25th, people are out of their drugs. They're eating. They're sleeping. They want help. I tried. There was no bed space. I couldn't get people into any kind of treatment.
So they would actually come to you when they were completely out of options and ask for help.
Yeah. Well,
clarity. And that's what I'm hearing you say. When they reached a place of clarity, they wanted something different.
Yeah. And I only had a short period because the first was going to come up again.
How easy was it for you to get somebody the help that they needed?
We couldn't. I couldn't find bed space. I didn't know where to put them.
Where would they go after they got out if you could have?
If I could get them into a treatment center.
If you could get them into a treatment center and then they got out of treatment, then what?
I don't know. I was just concerned about getting them
to treatment.
Getting into treatment. That's all my goal was.
But you were unable to accomplish that.
No, because there was no beds.
Yeah.
And when there was beds, it was too late. If the first rolled around, they didn't want help no more. So it happened every month. It was the same thing.
Yeah.
And I'd say to my supervisors, hey, can't we find some beds for these people when they want it? This is our opportunity. Yeah. We need to jump on it because we ain't going to have it again until next month.
Yeah.
And they might not be alive next month.
So you're saying on a monthly basis, even people that presented with major mental illness actually came to you on a percentage. If you were to guess a percentage of people that were looking for help around that period of time when they were completely out of options and resources, what would you say the percentage of people that were seeking help was?
I would say it's 40%.
That's actually pretty high.
Yeah, everybody was coming.
That's actually pretty high.
I got to know everybody there. They called me Uncle Dennis.
Yeah.
I got to know all the clients there. Some of them I knew on the streets.
And so from your superiors, you essentially got no response.
No response. I was basically just doing what I could do. There was no addressing any causes there.
Hey,
we were told,
go ahead.
Don't change behavior. We're not here to change behaviors.
So you were told that by your supervisors?
Yeah, that's how we ran it.
We're not here to change behavior.
No, we're here to make sure that they stay alive, that their needs are met, they're fed, they're warm, and that they don't hurt each other.
As time went on, I felt like an enabler more than a helper. When they would come to that refrigerator and get 2 beers and maybe it made them feel better for that morning, but when they kept getting there, because we had that program doesn't mean they don't have other ways to get more when they want more.
Right.
And especially when payday comes. So, and then they would sometimes just get obliterated. And then the problems, the personal problems that you had to deal with on those days could seem overwhelming.
Yeah.
I know for me personally, in my life, had I not had mentors and teachers and people to help guide me along the way, to tell me maybe this is wrong, you need to do this, you need to do that, I wouldn't have been able to succeed in my life had I not had people to guide me. And so that's what I really see as people walking unguided into an apartment and not really getting any kind of guidance on what to do next.
And then it's like Erica, right? She's not with us anymore, but her boyfriend had beat the brakes off her and he went to jail for it, okay? And the judge released him right back to this building. And he went right back to her and he says, I'm going to kill you, bitch. And the next thing is she woke up a week later in Harborview with a broken over bone, her face, and I've seen it too many times. I mean, it's like that woman I was telling you, April, was assaulted by this dude that stands, 3 feet taller than her, and witnessed by staff. And then he takes another person, basically captive in his apartment and beats the brakes off of her. And there he is, right back in there.
What other kind of stuff goes on in the building? Are there ever assaults, people?
I have known that there are people who have come in and invaded people. I am very careful. No one's going to mess with me.
Yeah.
Okay, so I'm not worried about that, but I've seen it.
Did you ever experience like folks that committed crimes inside the building against each other?
Oh, yeah.
Any kind of sexual assaults and things like that? Do you
Sexual
remember
assaults?
Antoinette?
Yeah, there were sexual assaults. There was fights.
Yeah.
I was carrying a knife for a while,
Yeah, I remember that.
both hands,
Yeah.
because there was people jumping people in the hallways,
Yeah.
taking them down.
Yeah.
This building of chaos, drugs, like overdosing,
Yeah. Are there a lot of drugs?
physical fights, like murders.
Are you aware of any kind of calls for things like rape, murder, violence that has been perpetrated on folks within the building?
Yes,
And so is this common?
all of them. I wouldn't say common, but I say it's to an average person, I'd say they think it's common because in my life that doesn't exist. And it's very, very, very difficult to watch those situations happen because they unfold behind closed doors.
It's freaking tragic.
What about the one of the longtime 1811 resident that was in there? He's in the promotional videos for the funding and all that. He died of an overdose about a month, maybe 3 weeks ago.
Oh, really?
And
And they're not
he
reporting
didn't do
it.
opiates. So the guy that he was with gave him the wrong pipe.
Oh my gosh.
And he's trying to revive him with his own Narcan and not telling staff, this shit's happening. It's like, it's just really, it's everywhere.
We only have 2, maybe 3 buildings in all of the greater Seattle area that do focus on abstinence. It's wild.
It's like, I don't know why they don't focus on that. That's the major problem,
Yeah.
The addiction, there's a lot of underlying issues to people,
Yeah.
why they're used, and they don't address that.
Do you think that people could get to where you've gotten if they're not clean?
You got to be clean.
Yeah. Why is that, Dennis?
Because you're just not going to be able to do what you want to do. The drugs will run you.
Yeah.
You don't run the drugs, they run you.
What you said about, becoming clean after arrest, most people, that is the story. I mean, I've talked to 2 people this week, both who said, oh, I was arrested at least 40 times before. But the cool part of those stories for me is it's not that they were arrested being punished. It's that an officer was taking interest, and coming back and saying, you're better than this. Your wife is calling me. Like, come on.
Yeah.
I'm not going to arrest you today. Can I take you somewhere else to get help?
Went to the IF Projects fundraiser, and it was awesome to see these women, former convicts,
Yeah.
get up on stage and tell their story. And every single one of them attributed their success to having been arrested and then being led towards a personal accountability perspective. And now they're proud of themselves, and they should be proud of themselves because they've overcome the old way they did things, and they've charted a new course, and they're being successful. I would like people to think and consider the most compassionate thing that we could do would be to interrupt that cycle of addiction and then provide real meaningful care for those people without the opportunity to go back.
That's right. During incarceration,
Yeah.
during that
Yeah.
suspended time,
Yep.
separation services and accountability. How much money is being spent with the amount of first responder and police response to these buildings annually?
Yeah, I'm actually working on cost benefit analysis right now. It gets a little bit more tricky even to do the math because we've got consistently mandatory overtime for all these different first responders. What does it cost every time I deploy? Because I want to make the case I know that about half the budget is first response, right? Is public safety provision in this city. So that's a lot of money. We have a $7.8 billion biennial budget. It's a lot of money that we're spending. That's just Seattle, right? And then you've also got a county budget, state. And So it looks to me like we're spending millions and millions of dollars, but we're just prolonging suffering. It would be faster and
Based on the
better
approach that we're currently taking?
Yeah, because I just keep dispatching to triage, right? So in one interview, someone said, "Is this a Band-Aid on a bullet hole?" And I said, "Yes."
Yeah.
Sometimes kind of, almost literally. It really is.
So you mentioned a report. So what is the report about?
The report is about the King County Regional Homelessness Authority's spending and an outreach program that they started. So the King County Regional Homelessness Authority was created in 2022. It's a continuum of care. And so it was designed to take state and county and city funding for homelessness and then distribute it out to nonprofits working to address homelessness in King County. And within their first year, which had the $10 million funding, they say they housed 100 people, 115 people. So that's 100 outreach workers, $10 million, 115 people housed.
And any data reported on whether the people that they claimed that they housed actually remain housed?
No.
Or what kind of housing they were in?
No.
None of that kind of information?
No, I think I got some numbers on type of housing, permanent, supportive, hotels.
Oh, some of the hotels.
I think so.
Local hotel programs.
Yeah.
How much money did they give out to other agencies in Seattle during that time?
Yeah, so in 2022, which was their first year in existence, they gave out $107 million in contracts.
$107 million?
$107 million.
Okay, so
to about 55 organizations. And, a big part of this was about transparency. So
Right.
I'm digging through their websites for anything that they're providing publicly, and then also contacting them and saying, here's what I'm doing. Will you provide your numbers? So maybe it's true that they actually did house more people than that.
But they're not
the
making
issue is
it
that
public knowledge.
they wouldn't tell me, and they're not telling the public
And
at large.
so
and
have-
about half of those top recipients, $10 million contracts, would not tell me or do not make available to the public
The information.
basic information.
Well, which is really interesting because I know that everything that we do is reported into the HMIS system. So, and the HMIS system is there to report to funders and things
Okay.
like that. And the
Yeah.
funders are the city.
Yeah.
So that's a little bit confusing.
Yeah. That's interesting. That's
It
good.
is. So when otherwise, if it's not written down, it's not documented, or it didn't happen, right? If it's not documented, it didn't happen. And I was trained that from day one in going to work for a social service agency. So whenever I housed somebody, I had to report it in HMIS, but I also had to report it in some interagency documentation because those numbers have to go back to the city or
Right.
whoever is giving that funding. I got very excited when I was reading the report because I was like, oh my gosh, somebody's finally saying it out loud. Because as a program supervisor, I entered information into a couple of different systems. And, when I housed somebody, so over a 3-year and 2-month period of time that I worked as a supervisor of the housing case management programs, it was my job to train my staff, 5 staff amongst 3 programs to house people. What constituted as housing is like, for example, if you have a mom in Alabama, now I had to make sure and have it approved and talk to the mom in Alabama, who could have really been anybody, and say, oh, so-and-so, says that they can come home. If I send you on a bus, that constitutes as housed. If you go into a temporary placement in a hotel, that constitutes as housed. If you go into low-income housing and you're immediately evicted, well, you still count on my house number. If you die in housing, well, then you're housed. If you get evicted and you're back in shelter a week later, that doesn't mean that I didn't get you housed last week. So when we're looking at the numbers, I think that it is challenging to really say anything. We're not looking at outcomes, right? We're not looking, and that was my biggest question with the report is okay, but what are the outcomes?
Sure. And I think what we're trying to say is, look, if you won't even tell us this kind of information, like your best looking number, then how could we ever expect to get those kind of outcomes, which we agree, those are the important ones. It's not about just putting someone in housing
right.
and calling it good.
And you have a really unique perspective because you came from homelessness, you're living in one of the buildings, and then you were serving in a lot of these environments. So that is why I think your message is so credible. And I also think it's very important for us to recognize that you probably wouldn't have felt as safe to share openly about your experience if you worked there still, because you might be at risk.
Oh, yeah, I would have been at risk. I would have had to lie to you.
Yeah.
I would not have been able to tell the truth.
You probably would have just not answered.
I wouldn't have answered. I'd have said, no, I can't do that.
Yeah.
I would have said no, because they would have fired me or they'd have held it against me. They're dropping the ball on people. It's not more like, I'm not talking smack against the agency so much so. What I'm talking about is you're letting people die.
I just want you to know that it's not just that agency, it's all of them.
Yeah. They're doing the same thing in these other buildings, and they need to stop doing that. And if people knew what they were doing, I mean, they wouldn't back it. I mean, I think people don't want to see the homelessness situation going on. They don't want to get involved, and they'll walk around it. But I think if they heard how it's being handled, they might want to say something about it. Say, "Wow, this is how you're doing it? Just getting people in to die?"
If the people in the community knew
Yeah.
what was happening for real,
That's why we're telling these stories.
they would be like, what the fuck? And, and we shouldn't have to get to a point of being like, we're going to expose you so that you fucking do something.
You know, I have been diagnosed with pre-service, in-service, and post-service PTSD. But nothing in my lifetime, trauma, combat, I don't care what it is, compares to the loss that I suffered here. Somebody said, well, what about grief counseling? That'd be fine if the deaths stopped happening, and then I could grieve those that have happened. But grief counseling, when the traumas continue to go on.
In the coming year, King County will open additional health through housing units in Federal Way, in Kirkland, bringing even more people inside. Safe, affordable housing for all has the greatest impact on the health of our community.
It's not working. They need to change. Somebody needs to step up and do something about it.
Now that we've seen what happens behind closed doors, it's time that we do something about it. We've listened as Dow Constantine told us that mental health and drugs aren't a part of the problem. Well, that's obviously not true. We've listened to how KCRHA has spent hundreds of millions of dollars to solve the problem. But we've seen a 23% increase in homelessness in Seattle. We've heard of how these buildings are evidence-based. Evidence of what? We've heard from some very credible experts that talk about the conditions inside of these buildings. Murders, drugs, rape, assaults. These things are happening every day. Staff don't feel safe. They're not equipped to deal with the trauma that they experience just working inside of the buildings. Priority 1 calls are not abnormal inside of these buildings on a regular basis. What are we doing? When are we going to scrutinize these buildings, this policy, and our leadership? How bad do things need to get? How many more people need to die before you take a stand?